So I wanted to take a little bit of time today to address some stretches and just a few really basic tips that might help if you're dealing with pudendal neuralgia. So this is a condition that unfortunately up to about 50% of people, they don't actually know why it even started, why it even happened. But it's usually due to some type of irritation of the pudendal nerve, which runs in the pelvic floor area. So what you're going to feel is kind of a saddle region pain. So you're going to feel pain in the groin, in the genitals, in the anal area. For men, it's going to potentially extend to the tip of the penis as well. So it's just this whole area right here. It is very, very painful, and it can be a very discouraging and debilitating syndrome for people because it really causes a lot of pain when you're sitting. So let's go ahead and begin with some stretches that are absolutely very wonderful for pudendal neuralgia. Whether or not you've got a confirmed case, these stretches aren't going to hurt you. And then we'll talk about some tips if you think you might be dealing with pudendal neuralgia. So go ahead and come onto your back. The first exercise or the first stretch that we're going to do is a knee to chest stretch. So you might want to have a pillow for your head for comfort. I have a yoga block right here, which I'm actually going to use under my head if I need it, but a pillow is probably a little bit more comfortable. So come onto your back. And our first stretch is going to be a knee to chest stretch. So really, really simple. This is the area that's very painful, and so we really are just trying to open up this area. Now, bring your knees to your chest, and you're going to breathe deeply. What I want you to not feel you have to do is hug your knees together. That's not so important for this pose. In yoga, there's a traditional wind relieving pose where everything's really tightly held in. You can feel free to let your knees be apart or together, whatever feels good to you. So go ahead and get into this comfortable position and just take some deep, deep, relaxing breaths. Again, I'm just going to hold on lightly to my shins. If you want to, you could actually pad up and support under your elbows with yoga blocks. So I only have one yoga block, but if you had 2 yoga blocks, you could play with having some yoga blocks under your elbows to help kind of support you as you're holding up your legs and just bringing them in toward your chest. And breathe deeply. Now, as you breathe, I want you to bring your attention to your pelvic floor, this area that hurts. And I want you to think about melting. I want you to think of the sensation of melting butter or melting chocolate, releasing, opening, blooming apart, melting apart. Whatever feels good to you, but to me that melting visual really, really helps. So breathe deeply for another couple of breaths, and then we'll move on to the next stretch. Remember to let that pelvic floor region, think of the area between your 2 sitting bones, just melting apart. Breathing deeply. Now go ahead and release the position. Put your feet down. Let your knees drop together just for a moment. Put your hands on your pelvis and breathe. Now we're going to move into frog stretch. So bring your knees apart and bring one leg up. Bring your hand through the inside of your leg, not the outside, but the inside of your leg, and hold on either around your shin or to the outside of the foot. So I'm just going to hold on around my shin. So now the other side, I go through the inside of my leg and hold on around the shin. And right here, we're just flopping our legs apart. I love calling this frog stretch. You are relaxed in this pose, and it's kind of a modified version of happy baby, which is another option. And what I'm going to do is I'm going to show you this frog stretch for just another breath or 2, and then I'll show you happy baby, which you can progress to or you can try. So take another deep breath in this frog stretch. It's one of my favorite poses. Think of the sacrum, the back of the pelvis it's on the floor. It's not lifted up off the floor. It's actually down on the floor. So you're really, really relaxed. And maybe you can only hold on to the outside of your legs. Maybe threading through the inside is too much. That's okay too. You can hold on out here, whatever feels good to you. Now, if you want to progress it to happy baby, I'm going to show you what that looks like. So you're in that frog stretch. And now instead of your feet being forward, they're actually going to come up toward the ceiling. So it's like you're stamping the ceiling with your feet, and you can hold on to the outside edges of your feet with your hands. In this position, again, try to make your sacrum on the floor. It's going to want to probably curl up, but you actually want to stretch that sacrum down toward the floor. So maybe even you're holding on to the outer shins and you can't quite reach the feet. That's okay. Just grab what you can. If this feels good to you, then do it. You want to feel like you're pulling the shins straight down toward the floor. Your sacrum is pressing down toward the floor as well. Now again, if this is too much, our regular old frog stretch is a wonderful, wonderful option. So let's go ahead and take 1 or 2 more breaths in either frog stretch or happy baby, breathing deeply. Last inhale and exhale. Again, you could be thinking of that pelvic floor area just melting and opening like a wide open flower in full bloom. Now go ahead and release one leg at a time onto the floor, feet wide, drop those knees together again. So just relax for a breath or 2 in this position. One more breath in and out. And for our final stretch, these are, simple stretches that you can really do anytime. We're going to flip onto our belly. But before we go there, I want to explain to you the idea of the pelvic drop technique. The pelvic drop is a feeling where you're not doing a Kegel. So a Kegel is a squeeze and lift of the pelvic floor. This is kind of the opposite. It's like a release of the pelvic floor, really, really releasing and opening. And it can be really hard for people with pudendal neuralgia to feel that. But one of the reasons that people often have pudendal neuralgia or a result of the pain is that their muscles are overly tense and overly active in the pelvic floor. They're really tight and they need to learn how to let them go. And so check in right now, see if you can feel that release of the pelvic floor, a pelvic drop rather than a squeeze and lift of a Kegel. So whereas a Kegel contraction is like you're squeezing your anus to help stop, like if you were going to pass gas, like you're going to stop that would be a Kegel contraction. We want to do the opposite, where you're actually releasing and letting go, lengthening and opening that vaginal area, the anal area, lengthening, opening, and releasing that area. Now, if it's too much to feel, if it's too much to do that, if you're just like, oh my gosh, I'm completely lost right now, then what I want you to do is actually use your fingers, or if you have a tool like a TheraWand, if that's something that your physical therapist has given you, you could also use that. So go ahead and put your fingers or the TheraWand in the area where you feel the most pain. And you can do this wearing underwear, or you can be wearing clothing, or you can be doing it on bare skin. But you just use your fingers in that area, and you go ahead and touch that area. So just gentle, steady pressure, and I'm just going to describe it. So gentle, steady pressure on the area that's painful. Nothing crazy hard. Very gentle. And I want you to breathe into that area. So don't even worry about releasing or doing a pelvic drop yet. Just gentle, steady pressure on that area, breathing into the area with your breath. When you feel like you're really kind of in a spot that's really a tender spot, you're really, really feeling that, go ahead and breathe a little more deeply. So breathe deeply into that area. What you're going to be doing is actually stimulating blood flow to this area, because what I want you to do next is to inhale and exhale and then gently circularly massage in that area. So you're pressing, you're feeling that area where it's tender for sure. You're pressing gently into that area, breathing slowly and deeply, and then you're going to keep breathing as you do a gentle circular massage in that area. So again, it's going to be down in your pelvic, your groin area. Go ahead and press gently, breathing, holding the pressure. And then when you need to release, you do gentle circular motions as you release the pressure and as you keep breathing deeply. So keep doing that, and I'm going to talk you through the next step that you may try, and that is to actually have your hands on the area that hurts and try to do that pelvic drop into the pressure of your fingers. So feel the release of your perineum, the area between the vagina and the anus if you're a female, and between the base of the penis and the anus if you're a male. So that area, you want to feel that area gently release as you do that pelvic drop. So again, to recap, there's 2 techniques we can do here with the pressure, the gentle pressure of your fingers on the groin area. You can do the gentle massage technique where you're bringing blood flow to the area, circulation, so good. Or you can also feel into this area as you practice that pelvic drop. But either way, breathe deeply and fully and expansively, and that's really going to help you as you're doing this. It's going to take a lot of tuning inward and practice, but don't be discouraged. So if you're ready to flip over onto your belly for our last exercise, just know that you may feel a little bit of tenderness and a little bit of maybe even tiny bit of aching after doing some of that massage. If it's ever too much, it means that you went too hard. So very gentle is what I said at the beginning. That is very key. A little bit of sensation is okay. Pain is not okay. So if you feel a little bit of aching or tenderness, just let your knees flop open and then together a couple of times, and then we're going to flip onto our stomach. So gently flop open and closed. Continue to breathe. And here we go, off of the pillow or the yoga block and onto our belly. So the last move we're going to do is simply some baby cobras. So in this position, just let your legs reach out behind you and bring your hands close to your pecs or your chest. And you're simply going to inhale, lift up, press into your hands, and come on down. This is very, very gentle and slow. Inhale, lift up, pressing down into your hands, and then come on down. So you're not really tensing through your butt. You don't need to. You don't need to protect your back like you would if you were doing a full cobra, where you might, want to play with different amounts of tensing your buttocks. This is really quite relaxed through the buttocks. And if you need to kind of shake things out, maybe shake out your legs, that's okay. Let everything be relaxed. We're just doing a very gentle extension of the low back, and come on down. Let's just do 3 more. Inhale and exhale. 2 more. Inhale and exhale. 1 more. Inhale and exhale. Bring those knees up, knees apart, and just drop your feet side to side. This is a really important one for many people with pelvic pain. They end up getting abdominal pain too, and abdominal discomfort. And this move can help massage out your abdominal area and just release any tightness that you may be holding there. So breathe deeply into your low belly. Lots of slow, deep breathing in this practice, which is my first tip when it comes to dealing with pudendal neuralgia. So 1 more time, back and forth, and then press up carefully onto your hands and knees. If you wish to move through child's pose, you can. You can do a knees together or a wide-kneed child's pose, so knees apart, feet together. You're just going to come forward. So you can stay in child's pose as I talk just a little bit longer and provide a couple of quick tips. Or you can come to seated with me right now, whatever is comfortable for you. But basically, if you do have pudendal neuralgia, just know that you may need to, it's kind of a difficult condition because not every doctor knows about it, and you may have to see a specialist. So you may have to consider, getting a referral or seeing if you can go directly to a pelvic floor physical therapist or a women's health physical therapist, which is kind of a misnomer because women's health physical therapists are not just for women. Men can see them too. You may want to talk to your doc if he or she is very knowledgeable about this condition. You can explore different options for medications. Sometimes they even do nerve blocks, but they're more intensive ways of treating it. And I definitely recommend doing the stretches that we just went through, doing that deep breathing, thinking of the melting of the pelvic floor, thinking of the pelvic drops, doing some of the self-massage, and working with a women's health physical therapist or a pelvic floor physio as a first line of defense. Using those conservative treatment options as a first line of defense is just a smart way to go because it's safe, there's really no risk, and you can do it at home too. So another couple of tips that I have for you is avoid repetitive exercises such as squats. Like if you're doing an exercise class or if you're doing a fitness routine of some sort that has lots and lots of repetitive squats, that's probably not the best idea for you right now. Also, cycling, whether it's stationary cycling or outdoor cycling, it's probably something you want to avoid at the moment. Just that saddle that you're sitting on is irritating to that area that you're trying to have it learn how to release and let go. And so the last thing you want to do is to be irritating that area. So you want to potentially incorporate more standing into your day. If you have an opportunity to have a standing desk at work, that's a great idea. Something where you can go between standing and sitting is wonderful. And the last quick couple of tips that I have for you is if you are doing Kegel exercises, stop doing Kegels for now. They're not probably ideal for you right now because, as I said during our stretching routine, these muscles tend to be quite tense actually in the pelvic region when you have pudendal neuralgia, and so we want to relax them, not be tensing them up. So stop the Kegels for now, and also consider using some kind of anti-inflammatory natural remedy such as certain essential oils can be very therapeutic as far as releasing tension and inflammation in the muscles of the body. So you can consider essential oils. Some that come to mind are lavender can be a lovely one. Wintergreen is a lovely one. You can also consider copaiba, frankincense. There are many, many out there. Consult with somebody who's a specialist in essential oils and herbal medicine, and that can be very helpful for releasing the muscles in a topical application. Plus, it's an excuse to give yourself a massage in the low back and butt area, the inner thigh area, the low abs even. All of those areas kind of around your groin can be really helpful at relaxing because when they release, it helps release the pelvic floor as well. So the other last final tip I have to you is to eat an anti-inflammatory diet. Our gut is actually so close to the pelvic region that this area is so intimately connected. So we want to really minimize inflammatory foods, minimize processed foods, sugars, soda pops. For some people, caffeine and super sugary beverages with artificial colors and flavorings can be really inflammatory. Many people also find that they have issues with gluten, dairy. Not everybody does, but those are some pretty big culprits for a lot of people. So work with someone who understands how to do an elimination diet and really, take it seriously because what you eat absolutely matters as far as your brain health, your mood, your energy, and certainly the inflammation in your gut and your entire body. So you want to focus on healing, soothing foods, cooked vegetables. Pineapple is incredibly anti-inflammatory, so eat fruits and vegetables, super unprocessed foods, and really keep it clean. So I hope that helped give you some tips for pudendal neuralgia and give you some stretches that will help as well. I wish you all the best in your healing journey, and please check the video notes for more resources that might help you as well. I will see you next